So I recently did a lecture at a university to undergraduate advanced anatomy students, and we talked about the nervous system and specifically the autonomic nervous system. And so I wanted to share that with you. So not everybody may know the terms, so I want to start with a definition. When we're talking about the nervous system, there's different aspects and different parts of the nervous system. In this lecture, we specifically talked about the autonomic nervous system. And so the autonomic nervous system is part of the peripheral nervous system. So we've got the central nervous system and we've got the peripheral nervous system. And the peripheral nervous system helps regulate physiological processes. Specifically, the autonomic nervous system helps with things like heart rate, blood pressure, respiration, digestion, sexual arousal, and it contains three different divisions: the sympathetic nervous system, the parasympathetic nervous system, and the enteric nervous system. So if we look at this from a schematic, this is what this looks like. We've got the central nervous system and we've got the parasympathetic nervous system. Underneath the parasympathetic nervous system, we've got what's called the somatic nervous system, which is really more of like motor output, like nervous system's going to send information out and creating action. And then we've got the autonomic nervous system. And then within the autonomic nervous system, we've got the enteric nervous system. That's really the largely the gut. It acts independently of all the other parts of the nervous system. It's also known as the second brain, and we'll talk a little bit about that here in a moment. We've got the sympathetic nervous system, which is really more that fight, flight, freeze, fawn part of the nervous system. And then we've got the parasympathetic nervous system, and that's really more of the rest, digest, and heal aspect of the nervous system. So if we look at the sympathetic nervous system and the parasympathetic nervous system, both systems send information from the central nervous system out, and that would be more of the output that would create an action in the different organ systems or the different systems of the body that it's affecting, but it also sends information back up towards the central nervous system. So that's the afferent and or efferent sending out and afferent sending back to the central nervous system. The enteric nervous system, like I mentioned, it's mainly in the gut. It's independent. It functions independently of the other parts of the nervous system. And it, like I said, it's called often the second brain. And oftentimes what we see is that there's this very real connection between the enteric nervous system in the gut and the brain, or this even the central nervous system, if you want to look at it that way. And largely that connection is the vagus nerve. And we're going to talk more about the vagus nerve in a little bit. But when you have inflammation in the gut, you will often have inflammation in the brain, and vice versa. When you have inflammation in the brain, you often will have inflammation in the gut. So what this means is our people that have things like irritable bowel syndrome, autoimmune disorders, digestive issues, often they may be the same people that experience things like brain fog or headaches, or maybe they have other aspects of symptoms that affect up higher at the neck and the head. It also means that our people that have brain injuries, concussions, other things that maybe have caused brain inflammation, like different post-viral infection disorders, they may also see gut disorders, irritable bowel syndrome, constipation, diarrhea, bloating, things like that. And so there's this very real connection. And so from a treatment standpoint, we have to consider that those are connected and be able to realize we may actually have to treat one and the other in order to affect the one. So we talked about the different functions of the sympathetic and the parasympathetic. We're going to go more into depth with that. The sympathetic nervous system being fight, flight, freeze, or fawn. Fawn being it's a scenario where the nervous system feels like the best case scenario or the best course of action is to just give up and give in. Freeze being your nervous system just causes you to freeze in fear or freeze to be still so you're not noticed. So that sympathetic nervous system really is by design to help get us out of danger and to help us survive. The parasympathetic nervous system is really more that relaxing part with the rest, the digestion, helps to heal. We can't heal as well if we don't have a good balance between these two and if we're not in that parasympathetic state. So when we're looking at where do we find the different parts of the nervous system, like if we're thinking sympathetic nervous system, where in the body is that? The sympathetic nervous system is mostly found in the thoracic spine and in upper lumbar spine. So that's the T1 through L2 that you see up here. And so even in front of those thoracic vertebrae, on the front side of the vertebrae, there are structures called sympathetic nerve ganglion or sympathetic nerve trunks. And so practically what this looks like a lot of times is a lot of people are stiff and tight through their mid-back. A lot of people sit slouched. A lot of people have shoulders that get rolled forward. And so there's this extra tension and stretch that's put on that mid-thoracic area. And so that, in theory, can affect the sympathetic nervous system, cause it to be more active, and leave you in that fight or flight state. In contrast, the parasympathetic nervous system is mainly found through a few specific cranial nerves as they come from the head and the cranium, and then also down at the tailbone through a few of the sacral nerve roots. We're not going to get too much into the deep anatomy, but essentially both the sympathetic and the parasympathetic nervous system, like we talked about earlier, they have portions that come from the central nervous system and send information out. Neurotransmitters help connect those two components. And then there's information sent out from the central nervous system to the rest of the body, to the different organs, to the different systems that they're sending info to. You can see on this picture, and if you can't see the picture, it's basically a picture of the brain and the spinal cord. And what it is showing just specifically the parasympathetic nervous system, all the different systems that it is sending information out to. So it's the different glands, the tear duct, the eyes, the salivary glands, the heart, the lungs, the liver, the intestines, the kidneys, the bladder, the reproductive organs. So there's a lot of systems that are involved with this aspect of the nervous system. And so you can see that the autonomic nervous system has a huge role in helping keep balance or homeostasis in our body. So when we look at the sympathetic nervous system, that fight or flight response, we'll see actions or we'll see changes in the body, such as the pupils dilating. We'll see an increase in heart rate and contractility. We'll see the bronchioles or the tubes that go into the lungs opening or dilating, relaxing, so that way more air can come in. We'll see blood being pushed or shunted towards the muscles. We'll see a decrease in gut activity. With the parasympathetic nervous system, we're going to see a constriction of the pupils. We're going to see the heart rate start to slow. We're going to see the tubes of the lungs start to constrict, not to a dangerous level necessarily, but they just kind of constrict because we don't need as much air. And we see digestion and input into the gut increase. And so the reason we see these things, like we talked about, the sympathetic nervous system is meant to get us out of danger. It's meant to help us survive. And so we get that dilation of the pupils because it helps let more light in. So that way we can see the different threats. We have an increase in heart rate so that way it can pump more blood and nutrients to our body so we can react. We see an increase and a dilation in the tubes of the lungs, the bronchioles, so that way we can get more air into the lungs, so that way we can run away or we can do what we need to and not be gasping for air as much. And we see a decrease in blood flow to the gut because our body's just not concerned about digesting food when we're trying to survive. And so we don't need to be spending that energy on things that aren't going to help us survive. In contrast, the parasympathetic nervous system is designed to help us relax, to conserve energy, to promote healing, digestion. And so we see that coming from a few different cranial nerves. We see it from cranial nerve 3, which is the oculomotor nerve that helps control the eyes and those pupils that we talked about. We see the facial nerve, which is cranial nerve 7. So that innervates the lacrimal glands, or the tear ducts, the salivary glands, the mucous membranes of the nasal cavity. We see that from the glossopharyngeal nerve, which is number 9, that innervates the parotid gland. We see that from the vagus nerve, which is number 10. And we're going to dive much deeper into the vagus nerve here in just a second. So with the parasympathetic nervous system, like I said, we see the pupils constrict because we don't need to be as aware of those threats around us. We see the lacrimal and salivary glands being stimulated because that's part of digestion. And we see the beat of the heart rate slow down. We see the GI tract, the gastrointestinal, the intestines, the digestive tract start to increase because now we have time to digest our food. We have time to absorb those nutrients. We have time to heal. We see things like relaxation of the bladder and the rectum so you can void and you can urinate and you can get those things out. That's part of digestion. We see things like sexual function be able to increase because now we are in that healing state. We're in that relaxation state. So let's dive a little bit deeper on the vagus nerve. So the vagus nerve is the longest nerve in the body. It makes up 75% of the parasympathetic nervous system. So that's a big deal. And you can see from this picture, if you can't see the picture is basically showing how the vagus nerve runs through the body. And essentially it outlines the trunk running from the base of the brain out the cranium, down the front of the neck, down the front of the thorax, into the esophagus, the heart, the lungs, into the intestines, all the way down into the pelvis. And so it covers a lot of ground. Its name means to wonder. And we can't talk about the vagus nerve without at least touching a little bit on the polyvagal theory. So the polyvagal theory was created by Stephen Porges. And essentially what it does is it talks about how the autonomic nervous system controls how we adapt to threats and to safety, how trauma can impact the nervous system. So here's a schematic and a picture of this. And so again, if you can't see this, it's essentially a Venn diagram. There's 3 circles, and those circles all have an overlapping area. But essentially, we've got one circle at the top here. It's the part of the parasympathetic nervous system. We've got a circle down here at the bottom left. It's also part of the parasympathetic nervous system because when it comes to the vagus nerve, we've got a vagus nerve on the left side and we got a vagus nerve on the right side. And there's different portions within the vagus nerve that serve different functions. And so they call it, or they describe it as the ventral vagal pathway and the dorsal vagal pathway. And so they have different functions. And so at the top, we've got part of the parasympathetic nervous system, the ventral vagal. And at the bottom left, we got the other part of the parasympathetic nervous system, which is the dorsal vagal. And then the bottom right circle, we've got the sympathetic nervous system. And so if everything's going well, we're relaxed, we're engaged in the activity that we enjoy, we're curious, we're creative, that's going to be in the parasympathetic nervous system. Our heart rate's normal, our muscle tone's normal. That's going to be more the ventral vagus nerve. But then there's a threat. Something happens, we got to get away. An emotional event happens, an emotional trauma, a physical trauma, something something triggers that sympathetic nervous system. So we see the heart rate increase, we see blood pressure increase, we start to go into that fight or flight. Part of what we also see with fight or flight is we start to see other changes in the body's tissues, which we're going to talk about here in a moment. And then if everything is functioning as it should, then once that threat is neutralized, once that threat is gone, once we're out of that scenario where we're in that emotional trauma, if we get out of that, then we can start to balance out, and that parasympathetic nervous system kicks back in and brings us back into balance. But then let's say we have an event, like we said, maybe a strong emotional event, emotional trauma, maybe a death of a loved one, something happens that causes us to be depressed, unhappy. That brings us into a different form of the parasympathetic state, where it's more the dorsal vagal portion, and our heart rate goes lower, and our muscle tone goes lower, our energy goes lower. And as long as this is just a temporary state, then that sympathetic nervous system, and the ventral vagal system will start to help kind of balance us back into that state. And so you can see that there's this interplay that happens of the different portions of the nervous system. And if we're functioning efficiently, that's meant to be balanced. It's not meant to be more dominated all the time by one or the other. But practically what we see is that we do see a lot of people living more in a sympathetic nervous system state, more that fight or flight, because of stress, because of emotional trauma, because of physical trauma, because of poor sleep, because of increased inflammation from, you name it, illnesses, food sensitivities, gut inflammation, whatever the case may be. And so in our world, what we see is that an increase in sympathetic nervous system activity leads to an increase in tension in tissues, which means increased stiffness for a lot of people, increased pain, increased inflammation. And so when we're looking at how do we treat these scenarios, we really have to consider what treatments will also affect the nervous system. And specifically for these people that are more in this fight or flight, what treatments can we choose that will help increase more parasympathetic nervous system activity, and specifically vagal nerve activity? So I mentioned in the discussion about the polyvagal theory that trauma can increase the sympathetic nervous system response. And when I was talking about trauma, I was talking about physical trauma, but I also mentioned emotional trauma. So physical trauma, that could be injuries, that could be anything that physically affects us and causes our system to ramp up. Emotional trauma could also cause a similar sympathetic nervous system response. And what we see is there's a great book called The Body Keeps the Score. And what it essentially means is that our body has memory, our tissues have memories. So, for example, an emotional trauma doesn't just affect mental health, it can also manifest in physical ways. And so sometimes what that looks like is there's a type of tissue called fascia, and that fascia, we found over the last few years that fascia has actually got a lot of nerve endings to it. And a lot of those nerve endings, nearly 40% or more of those nerve endings, are actually sympathetic nervous system fibers. And what that means is that an increase in the sympathetic nervous system would provide more input into this fascia, which could then, in theory, cause that tissue to constrict, because a lot of what the sympathetic nervous system does is it constricts, and it causes to constrict blood flow to tissues that are not as essential, say, in the moment. And so an increase in sympathetic nervous system could mean an increase in fascial tension. And if an emotional trauma triggers that sympathetic nervous system, you may feel more stiff, you may feel more pain, you may have more inflammation as a result of that emotional event. And so another connection to the nervous system that we have to talk about is the connection of the nervous system and the immune system. Chronic stress weakens the immune system. We also know that the fascia can affect the nervous system and is connected to the nervous system. We know that in that fascia can store or encapsulate these smaller viral particles, bacterial particles, fungi, and it's almost like a protective mechanism to keep it out of your system. But when that fascia is engaged, whether that's through a fascial release tool, deep tissue work of any kind, body work of any kind, your body can release that into your lymphatic system by design. That's what we need our system to do, to take that toxic material out of a system. The lymphatic system is part of our way of getting rid of that. However, what that means is now you've got these viral particles or you've got these bacterial particles in your lymphatic system, which can then ramp an immune response. And so then we might feel things like feel like we got hit by a bus, or like flu-like symptoms after we have some body work or after we have some form of treatment. And that's a sign that maybe the immune system has been ramped up. Gut inflammation. A majority of Americans probably are dealing with gut inflammation of some kind. And we know that 70 to 80% of the immune system is actually found in the gut. Well, there's a lot of fascial structures to the gut as well. And so when you start having this increase in sympathetic nervous system activity, that can affect what happens in the gut, which can affect what happens in the immune system, and vice versa. If you have something going on in the gut, that can affect what happens to the immune system, which can affect the nervous system. And so there's just this cycle that can happen. And so when I was giving this lecture, I wanted to bring it home to what are some maybe specific types of cases that we might see that specifically deal with nervous system dysfunction. And this is just a few. There are plenty of others, but dysautonomia, essentially a dysfunction of the autonomic nervous system. It's a big umbrella term that can include a few things. One of the things that it does include is a disorder called POTS, postural orthostatic tachycardia syndrome. A lot of times we'll see patients that have POTS that have things like this sudden increase in heart rate, usually like 30 beats per minute or more, an increase in dizziness because their blood pressure drops with this change in position. Sometimes it doesn't even feel like it has to be a change in position. They might have, I've had patients where they have different types of symptoms in their hands, like numbness, tingling, and coldness. They have lymphatic issues, and so there's this difficulty for them being able to get good drainage. And so they have swelling maybe on one side or the other, or they have bloating. Oftentimes, this is in conjunction with people that may or may not know that they have different types of connective tissue disorders like Ehlers-Danlos, in which there's different forms of Ehlers-Danlos. Other things we might see is vagus nerve dysfunction, which can look a lot of different ways. That can look like a flat affect where there's just no emotion. You see that a lot. Like a great example would be somebody that maybe is advanced in Parkinson's disease and they just got that flat affect, no emotion. We see that oftentimes with somebody that maybe has a vagal nerve issue, monotone, not a whole lot of change in their voice, just very flat, no intonation. Also could be a vagal nerve dysfunction. And then, of course, anything that the parasympathetic nervous system does, which part of it is to help us relax. And so if we're stuck in this fight or flight and we're not able to get out of it, that also could indicate that we have some vagal nerve dysfunction. Long COVID symptoms. We know that COVID affected way more than just the respiratory system. It was a multi-system virus. We've had patients where it caused heart palpitations, chest tightness, even after everything was ruled out, all the heart issues, the EKG, stress tests, everything came back negative, but they still had these issues. And so we start looking at things like the fascial tissue that surrounds the heart, the vagus nerve as it comes to the heart, the ribs, working through the ribs and the tissue between the ribs, and really working through that fascia and the different layers of the fascia. We've also seen a lot of brain fog after COVID. We've seen people that have had POTS triggered after COVID, autoimmune dysfunctions, things like that. And so when we're talking about the nervous system, one of the things I wanted to point out to these students is like, hey, if we're going to place this importance on the nervous system, there's got to be a way for us to be able to measure the health of the nervous system. And there's not necessarily a great way or a hard and fast way, but heart rate variability has become one of the ways that we can really get an idea of what's the health of the nervous system. And so heart rate variability, essentially, it's derived from a formula, but it's essentially the difference between the high of the heart rate when you breathe in and the low of the heart rate when you breathe out. And so the greater that difference, the greater that variability, the healthier the nervous system. The less that difference, the less variability, the less healthy the nervous system. And the reason why is that when there's greater variability, your nervous system has more adaptability to take on whatever is thrown at it. It's just like if you had a problem in front of you that you had to solve, and you only had one option, you don't really have too many things that you at your disposal to be able to solve that problem. You have to figure out how to make it work with that one option. Otherwise, it doesn't get solved. Whereas if you had 4 or 5 different options, now you can start to problem solve which one of these options or combinations of these options is going to help me to solve that problem. Same thing when you have a greater variability, you have more options in your nervous system to be able to adapt to whatever is thrown at it. And so a lot of the times people can use this information to help them to determine what their activity level should be for that day. There's different devices that measure it, the Oura Ring, the Whoop bracelet, the Apple Watch. There's other devices out there as well. But if you wake up and your heart rate variability is good, it's on the higher end, then maybe that's a day that you're going to do more intense of a workout. You're going to take on more of a stressful activity. If you wake up and your nervous system is on the lower end, your heart rate variability is lower, maybe that's a day that you choose more active recovery, that you choose things to help you recover and for the health of your nervous system and for relaxation. And so in our world, some of the treatments that we might use here at R3 Physio to address some of these nervous system disorders, craniosacral therapy, where we're really working with the fascial structures of the nervous system, visceral manipulation, where we're looking at the fascial structures that surround the different organs and the different organ systems. With both of these, the craniosacral therapy and the visceral manipulation or cranial work in general, we're really looking at the way that the body is designed is it's designed to protect what's more important. And so organs, arteries, nerves, these are structures that are way more important than muscles, tissue, joints, things like that. And so if your body knows, hey, these structures, if we move a certain way, or if we do this activity, that puts these structures in jeopardy. We don't want to do that. So let's stiffen up. Let's create some difficulty in moving that way. Let's change the way they move so they can't damage this vital structure. And then what happens is that can put stress or strain on other areas of the body, which then can lead to other issues. And so it may be that where the symptoms are, where the injury is not actually what the root of that issue is. We work with the vagus nerve. All nerves should be able to move, including the vagus nerve. The nerves should be able to lengthen to some degree. They should be able to slide around and through tissues that they pass through. And so they can get adhered down, just like our muscles can get adhered down, just like other tissues can get adhered down. And if they're adhered down and your body knows, hey, if I start to stretch that way, that's going to pull on that nerve, but that nerve's not going to move because it's stuck down there. That's not going to be good for that nerve. We need to tighten up and protect that. And so you might see tight hamstrings because the sciatic nerve is adhered down. Same thing with the vagus nerve. As the vagus nerve comes through the hip, let's say you've had whiplash injuries, let's say you've had concussions, that can cause adhesion through there, which could then cause your neck to be stiff. It could cause you to be more guarded to protect that. It could be that that vagus nerve is maybe not functioning as efficiently because of that. And so we see changes in digestion. We see symptoms that might feel like chest pressure or flutters of the heart, even though everything has been ruled out. And so then we start to look at those deeper fascial structures.